Hi, I'm Trish Zemantic. I'm a licensed psychologist and board certified behavior analyst, and I'm also the director of the Autism Diagnostic Clinic at the Munroe-Meyer Institute. Today, we're going to talk a little bit about diagnosing autism in toddlers, including the use of a device that is newly available. For the purpose of today's presentation, we will be using the term autism when we are talking about autism spectrum disorder. After the presentation, we hope you'll be able to talk through some of the characteristics of autism in toddlers, describe a little bit about how autism is diagnosed, and provide information on a new diagnostic tool. Autism includes difficulties in social interaction and communication, as well as the presence of restricted and repetitive patterns of behavior and interests. Now we'll talk a little bit about what this could look like in toddlers. For social communication, some common early signs include differences with eye contact. That can be eye contact that is too little or absent, inconsistent, or even too much. We can also note some differences in gesture use. So, around this age, toddlers should be able to use a variety of gestures. So, things like pointing to request, pointing to direct somebody's attention, waving hello and goodbye, shrugging, shaking their head yes or no. In toddlers with autism, we can see that gesture usage can be decreased or even absent. By around the age of 2, toddlers should have between 100 to 500 words, and they should be able to start combining these words into some simple phrases like want juice, more cookie, go play. There also can be some differences in responding when their name is called. So we might get reports from caregivers that the child doesn't seem to respond to their name at all, or they only respond when their name is called multiple times. We can also see some differences in how they respond when other people are talking. So in terms of checking in or looking back and being aware that someone is there. Around this age, we also should be starting to see the emergence of what we call symbolic or representational play, which is the idea that you can pretend that something is something else. So, for example, picking up a remote control, holding it to your ear, pretending it's a phone, and having a conversation with grandma. For restricted repetitive patterns of behavior or interests, we might notice strong dislikes of even very minor changes in routines or difficulties transitioning from one activity to the next or one location to the next. There might also be some sensory differences, like strong aversions to everyday sounds like a vacuum cleaner or a blender, difficulties accepting different types of food or textures of food, or even textures of clothing, like not being able to tolerate wearing jeans, for example. We might also see some strong sensory preferences, like looking at things up close or even from a side angle. Repetitive behaviors might include things like flapping hands, walking on tiptoes, body tensing, or spinning in circles. It can also include more subtle forms like just holding hands in a rigid manner or kind of splaying of the fingers. We might also note some very strong preferences for how things in the home are arranged, how things are said, or just in general how things are done. The really tricky part about autism is you might meet somebody that has almost all of these differences and they have autism. You might also meet a person that just has some of these differences and they also have autism. Autism is the fastest growing neurodevelopmental disorder in the United States, affecting about 1 in 31 children. The increase in prevalence is largely attributed to a variety of changes that have happened over time. First, in 2007, the American Academy of Pediatrics recommended that all pediatricians screen all children for autism. Next, in 2013, there were major changes in how we actually diagnose autism, and that seems to have allowed us to better identify people with autism who would have been overlooked in the past. Finally, there's just a general greater public awareness of autism and a better understanding of the different ways that it can present. So, in general, we're probably doing a much better job in identifying autism. While some environmental factors like maternal and paternal age, gestational diabetes, maternal obesity, and infections during pregnancy have been implicated in the development of autism, the mechanisms underlying many of these environmental factors are not well understood. Autism can be diagnosed at 18 months, sometimes even sooner, and caregivers typically recognize the first signs of autism very early in their child's development. Yet we're often not diagnosing autism until around the age of 4. So, why is there this delay? Well, it's really hard to get an autism evaluation, and many waitlists around the country are a year or even longer. There are also clinics around the country that are not accepting referrals for evaluations because their waitlists are so long. There's no medical test for autism. I can't give you an MRI or a blood test and know that you have autism. So that leaves us with a full psychological evaluation that typically involves numerous lengthy tests that are administered by an expert clinician. And these appointments typically take several hours. So, at a minimum, an autism evaluation typically includes an interview with the caregiver and the child, a caregiver completed questionnaire about adaptive skills, so those things that the child is doing to help take care of themselves, and some direct testing completed with the child focused on understanding their developmental or cognitive skills and their autism characteristics. So, why do we care about an autism diagnosis? In particular, why do we care about a medical diagnosis of autism? Well, a medical diagnosis of autism is actually important for a number of reasons. First, a medical diagnosis of autism is often needed to access autism-specific services and therapies, like applied behavior analysis or ABA therapy. And we know that ABA therapy is very effective for people with autism. Studies show that ABA therapy can lead to improvements in cognitive skills, communication skills, motor skills, social emotional skills, and adaptive skills. And it can also help with some unwanted or problematic behaviors as well. Studies also show that the earlier people receive ABA therapy, the stronger the benefit. People with autism are also at an increased risk for certain other conditions, like feeding disorders, genetic conditions, gastrointestinal conditions, and seizure disorders, as well as certain psychological conditions like intellectual developmental disorder, attention deficit hyperactivity disorder, mood disorders, and anxiety disorders. There is a faster way to diagnose autism. Decades of research using eye tracking technology has shown that people with autism pay much more attention to non-social information in the world. On the left side, you can see how a person without autism pays attention to social information, and that's represented by those little crosshairs. On the right side, you can see how a person with autism pays more attention to those non-social aspects. This difference has been shown even in very young children. EarlyPoint is a new FDA-authorized device for assisting in diagnosing autism in toddlers between the ages of 16 to 30 months using eye tracking technology. With EarlyPoint, we can typically cut appointment times down in half and cut our testing time down to about 30 minutes. The device itself takes about 15 to 20 minutes to implement, so this means we can see more children and help cut down our waiting lists.
For children with autism, the earlier the diagnosis, the better the long-term outcome. Unfortunately, fewer than 20% of children with autism are currently identified before the age of 3. That delay in diagnosis leads directly to delayed intervention and delayed treatment. However, with the EarlyPoint evaluation, we can test children between the ages of 16 and 30 months, assessing their progress on the core dimensions of autism over time. Typically, developing children viewing videos tend to focus on the same area of a scene at the same moment about 80% of the time. The looking behavior of children with ASD tends to differ, such as focusing on objects rather than faces, with important learning opportunities being missed in every social interaction. Using interpretable AI, EarlyPoint assesses individual looking behavior at a rate that is imperceptible to the human eye, measuring hundreds of focal preferences per second and then comparing those data to significant attentional moments for typically developing peers. This attentional funnel provides the clinically validated reference standard that gives parents, caregivers, and providers timely, objective, and accurate information concerning potential developmental vulnerabilities, allowing for earlier identification and treatment for ASD.
Early point was made following a two-step process. First, researchers trained the model to detect autism. To train the model, children went through the lengthy gold standard evaluation by expert clinicians, and they were categorized as having autism, being typically developing, or having developmental delays. Then they watched Early Point, which learned the different looking patterns of the different groups. Then the model was tested by having children watch Early Point, which then categorized the viewers as having autism, not having autism, or having developmental delays. This was then compared to the gold standard autism evaluation. And it turns out that Early Point is pretty good at detecting autism. At our clinic, parents complete a rating scale about their child's adaptive behavior before their appointment. For toddlers, we start their appointment with Early Point and then do a short play-based observation. If Early Point says the child's looking behavior is consistent with autism, and that's consistent with the other information we've gathered, we can be very confident that the child has autism. That's because there have been no reports of what we call a false positive. That is, there's been no time that Early Point has said the child's looking behavior is consistent with autism, and an expert clinician has disagreed. If, however, Early Point says the child's looking behavior is not consistent with autism, we will do some additional testing. That's because we know that there is a risk of false negatives, and we want to be very confident in our results. After we complete our testing, we meet with families to go over our results and recommendations. In general, we're able to complete these appointments in 2 hours or less. Right now, the device is only FDA authorized for use in toddlers 16 to 30 months. Toddlers have to be able to see and hear videos. If they need to wear glasses or hearing aids, and that allows them to see and hear the videos, then that's typically fine. There are some eye conditions that don't seem to work very well with Early Point, such as lazy eye or nystagmus. Early Point is also appropriate for use in children who come from English and Spanish-speaking families. In 2026, we expect that the FDA will also authorize Early Point for use in older children up to the age of 8. Right now, you can access an Early Point evaluation through our Autism Diagnostic Clinic. Providers in our psychology department also have the device, and they are typically stationed in primary care provider offices across the state of Nebraska. In the future, we hope to be able to partner with early interventionists, schools, and doctors' offices to increase the availability of Early Point evaluations. Children can get referred for an autism evaluation either through their medical provider or their caregiver. All children should be getting screened for developmental and behavioral concerns regularly, and they should have autism-specific screenings at 18 and 24 months old. Autism screenings are different than an autism evaluation. Autism-specific screenings are really quick measures that let somebody know if a child is at risk for autism and requires further assessment. Autism-specific screenings are necessary, but they're not sufficient for detecting all children who might be at risk for autism. We know that the common autism screeners used typically are more likely to miss girls and children that have average or above average cognitive or developmental skills. So in general, be cautious in relying too heavily on screeners to make decisions about referring for autism evaluations. Caregivers can also monitor their child's development using this free app that's available in English and Spanish. In addition to seeking a medical evaluation for autism, families can seek supports in birth to 3 programs. In Nebraska, this is called the Nebraska Early Development Network. We often hear from caregivers coming to our clinic that there had been a time early in their child's development where they had concerns about their child's development, or more specifically, concerns for autism, and they were advised to watch and wait. We would actually encourage you to seek an evaluation as soon as you have those concerns in order to prevent delays from accessing important services and therapies. We'd like to thank the Nebraska Council on Developmental Disabilities for helping to support this project.